Hi, I'm here to do my subcutaneous medication return. I have my full uniform on. I have my pen and my pen light in my pocket. I have my name badge, my stethoscope, no earrings, my hair is pulled back, watch, and I have clean shoes on. So let's go ahead and get started. We're gonna wash our hands. And we're going to locate our MAR. So this area of our table is the med room. So I have my MAR here. Then we are going to locate our medications. And since there are two heparins, I'm going to say Fanny Fundamentals is getting heparin, 1,300 units. So I'm going to decide which heparin we're going to use. We have a 10,000 unit per milliliter, and we have a 1,000 unit per milliliter. For 1,300 units, we're going to be using the 10,000 units per milliliter. So I'm going to set the other one aside so that we do not get confused. So this is the heparin that I chose, the 10,000 units per milliliter. We're going to check for the manufacturer's expiration date. So 02/2028, we're good there. Since it's been opened, we would check for a written expiration date, and it looks like an expiration date of 5/10/2020 is on here, so we're good there also. If there was no written date, then we would throw this one away and get a new one. Now we're going to do our first 6 writes. So I have our medication vial, I have our MAR, we have Fanny Fundamentals, 11/3/1955 for a birth date. No known allergies, the drug is heparin, so I have heparin. The dose is 1,300 units, so I'm going to be using the 10,000 units per 1 ml. The route is subcutaneously, and the time is stat. We will document on this later. Next, I'm going to choose the proper syringe. I have a 1 milliliter tuberculin safety syringe. That's what we're going to be using today. And then next we are going to be filling out our medication label. So I have Fanny Fundamentals, birthday of 11/3/1955. Heparin is our drug, heparin. 10,000 units, spelled out, per 1 milliliter for that vial. We have 1,300 units is the dose, subcutaneously. Added by me, Marissa Reuter, student nurse, date 4/15/2020. Time is stat, so we're going to be giving it at 1940. The date is the expiration date for the manufacturer, or the expiration date for the manufacturer, excuse me, 02/2028. So we have our medication label filled out. So next we are going to be cleansing the top of the vial vigorously with an alcohol wipe for 15 seconds using our watch. So beginning now. We'll do this vigorously for 15 seconds. Okay, we've cleaned it for 15 seconds. So now, since heparin's dose is in 1,300 units and we're using a milliliter syringe, we need to calculate that. I calculated it, and 1,300 units is 0.13 milliliters. So I'm going to be opening our syringe, and we will be drawing 0.13 milliliters of air into the syringe to inject into our vial. So I'm going to take the lid off carefully and set it sideways so we don't contaminate. And I can also scoop it up when we're done. We are going to bullseye and insert the air. I'm going to flip this over. And we are going to get our medication without touching the plunger. We are now going to be measuring 0.13 milliliters heparin. Okay, looks good. We have 0.13 milliliters of heparin. So I'm going to take it out and I'm going to scoop it up, the cap up, without touching it. Scoop. And I'm going to place the cap on there. So I'll show you, maybe you can see the 0.13. It's very small. It's hard to see. So there is my syringe. So we are going to be putting the medication label on it. I will make sure that it's not on any of the numbers, so it doesn't cover up any information that we need to see, and I'll fold it back on itself. Okay, so we have our label, not on anything, and you can see the 0.13. There's that. So now we are going to perform our second 6 rites. So I have Fanny Fundamentals. Heparin is the medication. 10,000 units per 1 ml is the vial that we're using. Birth date of 11/3/1955. She will be getting 1,300 units, so I have 1,300 units subcutaneously. Time is stat, so we have 1940 on our medication label, and we will document later. So now I will be taking this into the room, which is over here. So I'm going to take my drug vial, I have my MAR, and I have my syringe right here on the bedside table. I'm going to set it on the bedside table. I'm going to wash my hands. And I'm going to move the bedside table a little closer to the camera before I introduce myself. Okay, so I would introduce myself to the patient. I would say, hi, I'm Marissa. I'm the student nurse. I'm going to be giving you a medication today. Can I please get your name and date of birth? So Fanny Fundamentals, 11/3/1955. Great. And do you have any allergies? No known allergies. Perfect. Okay. So I'm going to explain to the patient what we're doing or what I'm giving, the procedure. So today I am going to be giving you your heparin. Heparin is an anticoagulant, it's a blood thinner, and this would be used because of your diagnosis of deep vein thrombosis. So I will do that. And then I'm going to do my final 6 rites to make sure everything is correct. So I have my medication. I have Fanny Fundamentals, 11/3/1955, yes. Heparin is the drug, no known allergies. So we have heparin, we have the 10,000 units per milliliter. I want to double check that. And it's given subcutaneously, 1,300 units. We have a date of 4/15/2020, a time of 1940, and this expires on 02/2028. We will document later on this when we're out of the room. Okay, so next we are going to get our gloves on. And I would loosen the cap on my syringe so it's ready to go. I'm going to open up my alcohol and select a site. So I'm going to select a site. This orange is looking really good tonight, so this will be our location. For heparin, you can only inject it in the abdomen, so that is our only choice. So here's my abdomen. So I have my alcohol swab. I'm going to bunch and hold. I'm going to cleanse the spot, starting in the middle, working my way out with the alcohol. Okay. I'm going to hold the bunch, let the alcohol dry, and then I am going to pick up my syringe. I'm going to let the patient know that there will be a poke. there's a poke coming. I'm going to dart it in at 90 degrees, and then I'm going to inject it slowly. And I'm going to hold for 5 seconds after I inject it. I'm going to release my hold, and then I'm going to remove my syringe. I'm going to engage my safety and put it into the sharps container right away. I'm going to look at the injection site, and maybe if there's any seepage or blood, I'm going to blot it, but I'm not going to massage it or press hard, so we're looking good there. And I'm going to take the vial out of the room. I'm going to gather up all my trash. Trash. This is all trash. I would take my gloves off. I would throw these in the trash also. Then I'm going to wash my hands and let the patient know that they can call if they need anything, but I would not touch anything before I left the room. And then I would let you know that, as I said, heparin can only be injected into the abdomen. And the other injection sites include the thighs, for one, the abdomen, for two, at least 2 inches away from the umbilicus, the posterior aspects of the arm, the flank, and subscapula. So there are the 5 spots. And that is it for my subcutaneous return. Thanks.